Hi, thanks. My name is Ruth Cooney, and together with my colleague Philip, we're going to present on the topic New Simulation Educator Roles and how they support interprofessional education and systems-based education. So, introduction. The World Health Organization defines interprofessional education as where students from two or more professions learn about, from, and with each other to enable effective collaboration and improve quality of care. So IPE is recognised as having a positive effect on teamwork and interprofessional cooperation within healthcare education and patient safety. So in this presentation, we're going to describe the new roles and responsibilities in simulation-based education and how they have supported our design, delivery and debriefing in healthcare simulation. So there's quite a few challenges of initiating an IPE. So they're documented quite well in literature, the barriers and enablers to IPE. So we're just going to run through some barriers and enablers. So some of the barriers we kind of have encountered so far is understanding and respect of roles, resources and coordination of IPE education, harmonization of curricula, standardization of learning content, and differing levels of knowledge. Some of the enablers are fostering an understanding of different healthcare roles, the ability to see things from a different perspective, enhanced teamworking and communication skills through learning from each other. So the strategy for IPE implementation, development of new roles within sim-based education, developing new IPE simulations, input from multidisciplinary teams, multidisciplinary debriefing with a view of providing multiple learning points and a better outcome for the patient. The learner's feedback also plays a role for improvement of the implementation of IPE. So the end goal is a shared mental model for patient care. So for a successful sim-based education, you do need buy-in from faculty and also learners. So we're going to talk about some of the simulation team and experience. We have healthcare professionals on our team, medical scientists, clinical nurse educators, and paramedics. So we'll just go into that in further detail. So my name is Ruth Cooney, and I'm a medical scientist in simulation. I have 18 years experience working within a clinical area of clinical science and laboratory medicine, holding roles of basic grade medical scientist, senior medical scientist, specialist, scientist, and my last role was chief medical scientist of a national laboratory service. So my experience as a medical scientist, my clinical experience is in clinical biochemistry, endocrinology, newborn screening and inherited metabolic diseases, and immunology. So day-to-day duties would include clinical interpretation, working within a multidisciplinary team, protocol development, patient safety, quality management, teaching and case-based learning. So currently in my role in simulation, I'm involved in undergraduate clinical skills, mid and hi-fi simulation, postgraduate advanced clinical skills and hi-fi simulation, and some speciality disciplines like the College of Anaesthesia hi-fi simulation. I'm also involved in coordination, development and delivery and evaluation of sim-based education, involvement in the most recent IPE scenarios that we've run, which is massive transfusion protocols, hyperkalemia management, polypharmacy overdose, polytrauma and psych. We also do testing of protocols within GUH with, again, the end goal of a shared mental model and enhancement of patient care and safety. I just put this photo in as a recent scenario that we ran, and it was an ED trauma scenario. And you can see a paramedic is doing a handover to the medical staff and nursing staff in the simulation. This is the second photo that we have here of the same sim, and basically where we had involvement from hemovigilance and the laboratory, and they logged some blood components onto the live laboratory information system, and it gave nursing a chance to actually practice the cross-checking and hanging of the simulated products and use the blood tracker, which we use in GUH, which was very, very good learning experience. So now I'm going to hand you over to my colleague Philip, who's telling you about his role.
Good evening, everyone. My name is Philip Arkelagasinos. I'm simulation clinical nurse educator here at the ICAPS. Just to give a quick background of my experience, over 17 years of clinical experience, mostly critical care nursing. I've taken kind of various roles, of course, starting with staff nurse level, CNM1, CNM2, and just before I started the nurse educator role, I was a clinical nurse specialist in cardiology. That was around three years in that specialty. I started with ICAPS maybe going back end of February 2021, so it's a fairly new role. I believe this is the one role that is in Ireland, newly created role. So the current activities is nearly similar to what my colleague Ruth have mentioned. See, we participate in undergraduate, postgraduate, and specialty groups, both clinical skills, teaching, or either it could be kind of a setup or high fidelity simulation. The School of Medicine, high-fi simulation is part of their curriculum. So year 3, 4, 5 have scenarios during those years. And postgraduate, again, in advanced skill, clinical skills and high fidelity simulation. Again, a couple of examples just to kind of elaborate the postgraduates that we work on. Again, there's only a very few examples of the clinical skills I've listed out, and the list just continues. And we could be talking for a bit more than the allocated time. The IPE part is again is a key focus actually where we work at any kind of postgraduate level. When a program comes to us, we look at actually developing that across a multidisciplinary team. Like everybody knows, any kind of clinical scenarios is not just dealt with one discipline. It's not just it's not just nursing or just biomedic itself. It's a collaborative approach. So you need to really have that multidisciplinary team approach to have a positive outcome for the patient. So again, a couple of scenarios where that is nursing specific. I've given that list out the examples there: tracheostomy emergencies and managing deteriorating patient in the ward. Again, like as nurse educator, is going back to what Dara kind of mentioned. The focus is actually to working towards our strategy, our strategy. It's a collaboration. We talk about a simulation to implement. It's like a jigsaw. There are pieces that need to come together and into the right place. So when we have multiple teams, you have extra set of eyes looking into those scenarios development, and you could delegate roles and share responsibilities for the common outcome in delivering patient safety and quality. Again, we take up those kind of the multidisciplinary team or the stakeholders. You could either be a partial part of that or a complete part of in those various roles. During that implementation process, we go through the scale of process from the point of contact that a program comes to us, from the coordination to the very end of evaluation of that particular program. We constantly kind of relook at any programs we develop, that how we can improve that certain programs, or has the guidelines been changed. So we have to keep updating the guidelines and change the scenarios accordingly. The other key focus again is actually expanding any simulations or the IPEPs that we develop. We just don't want to limit that just to locally. We want that to be expanded out to more like regionally and nationally, so that everybody gets the benefit of those programs. So that's the end of my slide. Just again, thank you everyone. Just a couple of pictures there from some of our simulation programs. Again, you can see our SIMAN Essential there with the tracheostomy tube in situ for the nursing specific tracheostomy emergency scenarios. That's in our same megacode Kelly, the SIMAN Essential in a Byrne scenario trauma, and that's an IP scenario a screenshot from on the right hand side. So I'm going to that's my presentation's done. I'm going to hand over the next presentation to Ruth back again. She's going to describe our third team member, Mike Smith. So Ruth is going to explain a few bits about Mike. Thank you.
Hi, I'm going to present the next few slides for Mike Smith, who's busy at the undergrad programme at the moment. So Mike Smith is currently employed as a clinical skills and simulation technician in the School of Medicine in NUI Galway. He's 13 years as a paramedic experience with the HSE National Ambulance Service. And as a paramedic, he logged over 10,000 emergency calls involving patients of all age groups and presentations as varied as cardiac arrest, chest pain, drug overdose, road traffic collisions, etc. Though he's in regular contact with multidisciplinary team members in the emergency department, where he gave numerous clinical handovers. And during his paramedic career, he co-designed a special study module in pre-hospital emergency care, which he led successfully for many years. This gave medical students a valuable opportunity to gain experience in pre-hospital emergency care by accompanying paramedics on call. So we have a picture of Mike here, and he's with one of our former students, Jan, and he is teaching him the correct lead placement for ECG measurement. So he supports and delivers undergraduate clinical skills and teaching in the School of Medicine and its medical academies, and delivery of simulation-based learning in conjunction with ICAPs to medical students and interns working in Galway University Hospital. He also leads the basic life support teaching program in years 2, 4 and 5, and he's the lead liaison supervisor for the transition years secondary students as part of his community outreach activities. He also gives support at undergrad open days. So Mike is a member of multiple committees, including the newly established Curriculum Review Group, and he was recently nominated for a Dean's Award for his exemplary leadership in promoting high quality teaching and learning. So just before I go through the summary, that's just a nice picture of our team, and it's not just us three that we've presented. It also comprises of Amber, Braun, Caroline, Bridie, Mary, Dan, Connor. So in summary, interprofessional education encompasses integration, communication, mutual trust and shared decision making with a common goal of improved patient care and safety. So at our Centre of Applied Patient Safety and Simulation, we have introduced simulation educators from different healthcare backgrounds, nursing, pre-hospital emergency care, medical science, to promote and support IP simulation. The hope is that these roles can enable IP by delivering a shared mental model approach to the delivery of healthcare. So thank you.